Welcome, everyone. Today, we have my lovely friend, April Jones. She's a naturopathic doctor. She mostly does women's health and hormones and some general naturopathic care. And she's going to walk us through some really interesting stuff about pregnancy prep and fertility and some things that you might not have heard of about how to, prep for pregnancy or have successful pregnancies. So, yeah, we're excited to have you here, April.
Thank you. I'm so excited to be here. This is
Yeah, we're really excited to talk to you. We have tons of questions for you. I know I do, at least.
amazing. Great. I'm happy to answer anything. I could talk about this all day.
Yes. Okay, well,
Yay.
let's dive in. So, April, what are some signs that someone could benefit from pregnancy prep? At what point could a woman think, oh, maybe I should look into something to support my fertility?
So that is such a great question because there's so many different aspects of someone's life where they can think about their fertility and if they need to support it. And so to start, of course, there's the obvious answer of somebody is thinking about wanting to start a family and they want to know if there's anything specifically that they could do to support their health before they begin that process. And so that would maybe be like in an ideal world, somebody has time, somebody has, maybe at least 3 months, but 6 months to a year, even longer than that, where they can really start thinking about how they can support their health to promote a healthy pregnancy. So that's like that first kind of category.
I love that. And by the way, really quick, so you said it could sometimes take like a year, which I think makes sense, but that might sound really long to some people. So what would make someone want to start thinking about it even like a year in advance?
I think if somebody has time, the reason why sometimes we need time is because if, they start working with an integrated practitioner, they start working with me or somebody else, and a health condition is uncovered, it's great to be able to have a little bit of time to get that under control before they start trying to conceive. So that's kind of like that year mark, right? If somebody's thinking more so into a little bit of a closer time frame, like 6 to 3 months, we know that it takes about 3 months for an egg to mature. And so if somebody has 3 months before they are going to start trying to become pregnant, then they have time to help prepare that egg to be the healthiest egg it can be before it ovulates and then maybe creates like their future baby.
Whoa, that's so cool to put it
Yeah.
that
Isn't
way.
that crazy? Yeah.
And a year does sound really long. So when I started trying to get pregnant the first time, had no idea that there were going to be any issues because I don't have any sort of like underlying chronic condition. And so by the end of that year, it took almost exactly a year, which is kind of funny. It felt like it had been 10. Like it felt
Yeah.
so long. And so I know that people who are like, I'm ready now are going to be like, what? I have to wait that long? But I think people should prepare themselves. Like it really could take that long.
That's
Yeah.
such a great point. Yeah. And I resonate with that. And I feel like I've had so many patients with the same experience, like that month after month after month of them still having a negative pregnancy test can be so heartbreaking. And if you think about a year, that might be 12 negative pregnancy tests, or that might have been like 12 opportunities in their mind to be able to become pregnant. And so
Yeah.
that's what's hard. So that's the hard part. But there is good news too, because it's like if somebody doesn't even have 3 months or they find out, oh my gosh, like I'm pregnant now, right? There's still so much that can be done early on in the game to help promote like a healthy pregnancy because a lot of people actually just get pregnant by accident and they still have like a perfectly healthy pregnancy and a perfectly healthy baby. So it's not to say that they have to do the prep work, but if they have time, then it can help out for sure.
Yeah. And I'm curious about this, April, because when I've worked with fertility patients, it's so hard to ask someone to stop trying for any period of time. How do you go about that? Do you tell people, like, if you can, let's pause so they're not getting the mental anguish of negative pregnancy tests, or do you not have people ever pause trying?
I've never had a case where I've had to have someone pause trying. And I think it's because most of the time people come to me, maybe have been already trying for a while. And then we're kind of saying, okay, they might have done the standard workup, like they've had a ultrasound and they've done, different interventions. Maybe their partner has had a semen analysis and they're like, okay, everything is like supposed to be normal, but I'm still having a hard time. And then if they want to kind of wait for a few months while we're doing some workup, I support them in that. But if they're like, I don't want to wait, then that's okay too. It's really case by case because they still could become pregnant. And that's actually happened a couple of times where I'm working with somebody, literally we have a visit and then like a couple weeks later, like they have a positive test. And I think that's so hopeful too, because it's like the whole time they just had this like hope and they were moving towards that goal and then they get what they wanted in the end. But then they're still almost better off because we know, okay, they're on really good multivitamin, they're on a really good, they're on like the protocol that will really help support their pregnancy. And I think that alone can be helpful too.
Yeah, that's amazing. It was just your energy, just being in your sphere. And they got pregnant.
I wish I had that gift.
Everyone go hang out with April if you want to get pregnant. Well, I know you mentioned, sometimes people find out they have conditions that would impact their fertility. I know you see some of those conditions and maybe some people wouldn't expect too. So what are some of these conditions that impact fertility?
So some of the more obvious ones can be things like thyroid disorders or PCOS, anything that can cause issues with ovulation. And so we really need, of course, like for a pregnancy to occur, we need healthy ovulation to be happening, right? And so anything that can impact that ovulatory phase of a cycle is going to be impacting pregnancy rates. And so that's a big deal. Other like underlying things like chronic stress or autoimmune, inflammation, under eating, over exercising. I think I haven't seen a ton of this in practice, but I'd imagine with the focus on wellness and kind of like the toxic side of the wellness world, there's a lot of like under eating, over moving, like over stressing yourself. And yeah, that can absolutely impact ovulation too. And so that's something that sometimes needs to be addressed.
Yeah, definitely.
Yeah.
Yeah. Well, Katie, do you have any questions so far?
Yeah. So what are some of the things that you suggest just like as like a blanket statement if you're wanting to get pregnant before you even super dive into like blood work and stuff? What are some things that you should just go ahead and do that would be good for you to do?
I think one of the most important things women can do is pay attention to their cycle. And so getting those cycle details. How many days apart are your cycles? So that's like your cycle length, right? And so we need to know, okay, what is like your normal cycle cadence? I really feel like technology makes it easy now, but getting familiar with signs of fertility, like taking a temperature and seeing if you're ovulating. There's things like Temp Drop, which is a wearable. The Aura Ring has natural cycles linked in, and now there's also natural cycles. Excuse me. There's more higher tech tools as well, but kind of just some of those basics of like, okay, first, let's try to get familiar with your cycle. And then after that, kind of looking at lifestyle. How stressed are you, right? Like, is there anything you can do to kind of help reduce your stress a little bit? Are you eating any colorful fruits and vegetables like at all? Like just increasing that antioxidant content a little bit can also be like a focus too. And I think it's kind of fun to think about what we can just add in as opposed to what to take away. So it's like eat more fruits and vegetables, and try to manage stress, get a little bit of movement. And those are just some foundational things, like even before getting labs done, that I think can be helpful to kind of support fertility and get to know your body a little bit better.
I love that.
I know people are going to totally push back on the stress thing because maybe they have a stressful job or maybe this is like a secondary infertility kind of thing. They already have a kid and then trying to get pregnant can be really stressful just on its own. So I know people are always like, well, I can't do that.
Yeah.
What are the best ways to like reduce stress? I'm asking because when the first person I went to that was like, are you stressed? I'm like, yeah, I am because of this.
Exactly. Yeah, I think it depends on the person, but some people are open to like maybe starting a practice, whether that's just trying to focus on breathing for a couple minutes a day or trying to start a meditation app or moving their body or going outside. So for some people, that seems like very nebulous and something that they're not really interested in doing. And if that's that person, and if they have the means to like maybe trying to go do something for them like once a week, once every other week, even once a month. Like, can you book a massage? Can you go get a pedicure? Can you take a bath, right? Like little things. It's kind of like a self-care menu I like to provide. And then whatever the person feels like is an easy thing for them to do, or maybe something that they're already doing, they can kind of stack in that like stress management piece within that.
I like that. I love that because it's stressful to try to not be stressed.
It is, yeah.
Yeah, that's like the whole paradox. And so I feel like people get really frustrated and upset with themselves or feel shame around not being able to feel less stressed. And so one newer thing I've been trying is like having people, this is more like Katie's therapy realm, but having people connect to that shame or that disappointment in themselves or frustration and like just hold themselves in it and like see if they can like regulate their nervous system. Because I feel like a regulated nervous system helps us be less stressed about life. So I love the nervous system. So I like using that stuff.
I love that. I think that's so important because, I think as women too, we're like, oh, great, I'm stressed. And then you're like mad at yourself for being stressed. And
you're
then
like, one more thing I have to take care of.
one more thing. Yeah, I love that.
Yeah.
I also think too, like if it's before pregnancy, there's a lot of really great adaptogens that can be used to kind of help mitigate stress. And so that's a big piece. I mean, there's like herbs like ashwagandha and shatavari and things that have actually been studied to be beneficial in fertility rates and things along those lines. So even if you can't really implement a practice, if you can get a good recommendation for some, botanicals that can kind of help your body adapt to the stress that you're experiencing can be easier.
I like that a lot.
Yeah, and the reason I asked is because I think a lot of people think that like stress management, it does have to be this big huge thing, because I know when I tell my clients like we need to regulate your nervous system, Rachel, like you said, they think it's going to be this big thing. And I always tell them, no, it's just a bunch of little things that make you feel safe that like accumulate over time and help bring your nervous system back down. Like just go outside. People don't go outside anymore. They just sit inside all the time. I said, just go take a walk, like 10 minutes.
Yeah,
That's
huge.
such a good recommendation. Yeah. Just being outside. It's like sensory. You're just like, oh, okay, I'm back, and then you notice things without like, I know like noticing is an important part of nervous system regulation, but when you're outside, you don't even know you're doing it, but you're like, oh, the weather, the birds, like it's nice out.
Yeah. And don't take your phone. Don't look at your phone when you're
Yeah.
when you're on your walk, or like FaceTime someone. That doesn't count. You have to do it without technology.
I get mad at myself when I'm like Googling something when I'm like on a walk with my dog. I'm like looking up a recipe and I'm like, you were outside. Like, and it's almost those just like check-ins, like, okay, cool. Like put your phone down now. It's hard. So not bringing your phone would probably be the best recommendation.
Yeah.
I like that.
So once someone has all of the basic things down, what are some other signs that maybe something isn't quite right if they've been trying for a while? Like someone mentioned earlier, like, is your cycle normal? What's kind of the next thing to look at?
So if we've identified that the cycle is normal, there's ovulation happening every month, their partner has had like a semen analysis and the proper workup as well, then that's the point usually where like if they haven't had that advanced workup with OB-GYN, that's really important because it could be something structural, right? Like it could be something within their, uterine cavity, or whether that's like a polyp or something that's kind of preventing pregnancy from occurring. And, then that's when we can do a little bit more in regard to that workup that might be looking at other things that could be those like underlying sneaky causes of infertility that people don't really hear or talk about as much, where maybe there's like an autoimmune thing going on, right? Or inflammation happening, or there's something going on with your cortisol levels and things along those lines. So we can investigate a bit further at that point too, just to make sure we're not missing anything.
What are some of the biggest or most common reasons that you've seen in practice that women are having trouble getting pregnant?
what's tricky about that is sometimes with the unknown infertility cases, it's a little bit more of a subtle thing that might have been causing difficulties with becoming pregnant. And then once people really start focusing on their health and their wellness and their routines and just really like taking that time, and then they become pregnant, it's like we don't necessarily know that pinpointed thing.
Yeah.
So that's what's kind of hard. And that's I think what leaves a lot of people heartbroken is because they're like, I can't get pregnant and I don't know why, right? And then they get pregnant and they're like, I was told I wouldn't be able to get pregnant, and then they did. But I mean, like little things that can impact pregnancy if you're like, let's say like your thyroid labs are just right outside of that optimal range, right? There's little tweaks that we can make from like kind of that functional medicine space where it's like that optimization of the biochemistry too, that sometimes can help like move the needle. Where maybe somebody doesn't have like a full-blown thyroid disorder, but their TSH is a little bit above that optimal range where they would be able to get pregnant in that like easier way. And so things like that optimization can kind of come in at that time too, especially if everything else has been ruled out.
Yeah, that's pretty much what happened to me. I
Really?
could
Yeah.
get pregnant. I got pregnant 3 times, but I kept having chemical pregnancies.
Oh,
And we never figured out what it was. Like all of the stuff that got tested came back normal. I was about to start working with Rachel because she had just moved back to
awesome.
Arkansas. And I was like, Rachel,
Yeah.
can you help me figure this out? And then I literally came to our appointment. I was like, I'm pregnant.
And I was like, otherwise, I was like, here are 50 labs we're going to run. Like, we're going to do all of it.
Because no
Right.
one, like, I didn't get a huge workup done, but what I had gotten done, everything was totally fine. But yeah, we never figured it out, which I always still, I'm like, what was going on? Something shifted eventually, but yeah.
Yeah. That's what's so tricky about it too, right? Because it's like having answers feels so much better, right? But I'm so glad that you got your happy ending with
Thank
that.
you.
Yeah.
The things that I started doing acupuncture. I started taking, she gave me some Chinese herbs, which I don't know the name of, could not pronounce what was on the bottle, but I took those. And then I just had like shifted my diet quite a bit to be like as like non-processed as humanly possible and eating like tons of fruits and vegetables and getting more protein and all of that. And then I also, throughout that whole period, I'd already started like throwing like toxic cleaning stuff out of my house. I started like throwing everything out. I like purged my entire house of anything that could be toxic.
Yeah. That's amazing. That's all that important stuff that probably did move the needle in some way, you
Yeah.
know? Yeah. And then also your health is just better because of it anyway. So
Mm-hmm.
yeah.
True. Like, it doesn't hurt. Whenever I'm working with
Yeah.
people, I'm like, the worst that they actually usually say this. They're like, my husband's finally on board because he's like, I guess it's going to cost money to see you, but the worst thing that happens is we're both healthier.
Right? Yeah.
Exactly. Yeah.
Yeah. But okay, I'm curious, April. So, kind of as a next question here, I usually see people asking, like, how strict do I need to be with my diet, with this? And like adding in those antioxidants, like the fruits and veggies for the egg quality, like you said, is so helpful. But I mean, like you also said, people can be not trying at all and eating Chick-fil-A every day and get pregnant. So, where do you usually fall with like how strict someone should be with like being, quote, healthy with their diet and exercise and stuff?
That's a really good question because there's already that stress, right? There's already the stress of I'm trying to get pregnant and I still want this to be like enjoyable, but now I have to like calculate when I'm ovulating and like, think of all these things I have to do. I really love the 80-20, just like the standard 80-20 lifestyle for anything. Like, unless it's something that's like obviously like really bad for somebody, right? Like smoking, like don't do it. Or, I think even alcohol, like we know that it's not like great for fertility, but if somebody's like going to an event or going to something that they want to enjoy a glass of wine at, like that's fine, right? Like I don't want people to feel like they can't live their lives. But if at least 80% of the time they're doing their best, then I think that's a really good goal to strive for.
I love that. Yeah, I like
Yeah.
that a lot. And then I also have seen a lot of people, I think it's because of like Instagram ads and stuff targeting egg quality with supplements and everything. Are you really into the supplements for egg quality? Do you lean more toward lifestyle? Like, what's your take on things?
That's funny you asked that because I was actually thinking about that this morning and like it's kind of a tangent, but it's interesting that they're egg quality supplements, but then it almost makes women feel like their eggs aren't high quality if they're not taking them, right? So I feel like, but then also I'm like, okay, is it more of that quality over quantity conversation too, right? Because you only need one really healthy egg to have a baby. And so I think that gives a lot of people hope who might have like a low egg reserve, like that AMH marker that you can test on labs. Like even if your AMH is low, it doesn't necessarily mean you're never going to be able to become pregnant because you really only need one healthy egg to have a baby. And so that's kind of an aside. But I mean, these egg quality supplements are great because what they do is they help support your mitochondria and then they give you antioxidants. So I like to think of them as like a boost. And if you are somebody who is open to taking a couple more supplements a day, or if you're somebody who's like over the age of 35 and you're trying to start a family, those are definitely the people that I think are going to benefit most from these egg quality supplements. And something interesting that I read recently is that an egg cell has more mitochondria than like any other cell in your body,
Wow.
which is amazing. And we know the mitochondria is the powerhouse of the cell, right? So it makes your cells function optimally. And then like something I like to say to like make that a little bit more digestible too. It's like, okay, we have cells in our body, right? We have like heart cells and muscle cells, and all of our cells just want to be the best cell they can be for whatever area of our body they're in. So it's like our heart cells want to be the best heart cells. Well, our egg cells want to be the best egg cells. And then if you're trying to get pregnant, then if you can support that cell's health, then I think that that's a good goal. And so that's pretty much all these supplements are doing. And I do think they're also helpful for people who maybe have a harder time getting in like a good amount of fruits and veggies. I mean, the recommendation is 5 cups per day. And that's a lot for some people, especially if they're kind of just entering this world. And even it's hard for me sometimes, right? Like it just depends on how busy the week is and what's going on. And so I think that's where the supplements can be leaned on a little bit heavier for sure.
Yeah, that makes a lot of sense. Yeah, in the ND fertility group, I remember someone posted that they had a patient with an AMH of like 0.03 or something, and which is very, very low, and
Yeah.
they got pregnant. So like you said, you just need one healthy egg.
Just one healthy egg. Yeah. And so that gives a lot of people hope too, because
Yeah.
labs are information, but like also it doesn't like dictate what's going to happen at 100% in your body either. So
Yeah. I love
So,
that.
I'm curious what you think about people that are jumping into IVF and IUI, because I feel like obviously I do think some people are going to have to do that, and that's maybe
Yeah.
their only option. But I also feel like traditional medicine just pushes people into that so quickly. I remember like after my first miscarriage, it was like, okay, here's some letrozole, take that. And then if this happens again, we could look into IUI. And I was like, no, like I'm gonna give this
yeah.
a while. But by after the third miscarriage, I was like, I don't know, maybe we need to look into IUI and IVF. And I'm really glad I didn't. Do you think we're pushing people into that too quickly?
I do. Yeah. I think it is something that is so expensive. It's
Yeah.
such an investment, like both emotionally, financially for couples. And in an ideal world, there would be a little bit more time and investigation between that, like maybe a miscarriage or somebody trying for a long time and not getting pregnant yet, and that. The one area where I'm like, I think that if people want to jump into it faster is like a good question to ask always, like with patients, is like, what are your family planning goals? Like, do you want like 5 children, and how long have you been waiting, and what's your age, right? Or do you have like any family history of like, medical conditions, hormone sensitive cancers, things along those lines? And then sometimes people will opt for the advanced reproductive technology a little bit sooner, like depending on those things, right? Because there's no right answer. Some people try for a while and they're just not getting getting their baby and they go to that and they have like a healthy baby and everything
Mhm.
is wonderful. So there's no shame if people do go towards that, but I do wish there was more time and investigation in between the two of those things.
That makes a lot
Yeah.
of sense. Yeah, because I've seen people who, and I'm sure you've seen similar, April, who have like, gone ahead and tried IVF, which is even more advanced than IUI, and they had severely low iron, or they had their uterine lining wasn't thick enough, or something else was going on. And so even if they had a successful implantation, they couldn't sustain the
Yeah.
pregnancy. And so it's kind of like, like I feel like IVF doesn't make you necessarily have a pregnancy friendly uterus. It more just
Exactly.
it's trying to get that implantation. And like we don't know beyond that, whatever the thing was that was making fertility hard could also be affecting your uterus's ability and the rest of your body to carry a pregnancy. Yeah.
Yeah. Yeah.
And that's where also when fertility stuff, treatments like that started getting brought up for me, I was like, but I can get pregnant, but I can't stay pregnant. So how is this going to fix that? And they were just kind of like, I don't know, you'd have to try. It might work. And I was like, this is not the answer I'm looking for, because it
Yeah.
is so expensive and IVF is like really invasive and there's so many shots and drugs and
Yeah.
Yeah. Yeah. And so like not everybody, I think very few people have like medical coverage for,
Yeah.
a portion of that. And like that's also like so tragic because if you think about the general population, most people can't afford IVF. And then so it's like, okay, so we're only gonna really help people in the conventional lens who can afford it have a baby if they want, right? So yeah, that's pretty kind of sad, but
Yeah.
things
And
are changing.
do you work with people that are going through IVF?
I actually usually am working with people kind of before that stage.
Okay.
And luckily, like in regard to like my fertility patients so far, I haven't had any cases where it's like, okay, we've got to consider this at this point.
Okay.
But that's not to say that, that might not happen one day. And there is actually a lot of really great integrative, adjunctive, like in addition to like these advanced reproductive technologies that like NDs can provide as well. So
Yeah.
Yeah. And support people going through IVF.
yeah. Do you work with a lot of people, Rachel, who are going through IVF?
I have before, a handful, not a
Yeah.
lot, but I
Yeah.
have before.
Yeah.
But yeah,
Yeah.
most people, when they get to that point, usually the people that I was working with who were actively doing IVF we'd already started before, and
Yeah.
we'd already spent like a year and nothing shifted. Or it was like they just discovered naturopathic medicine from like a friend or something in the middle of doing their IVF. And they're like, wait, no one even checked my iron before I started
Yeah.
doing this IVF process. And so then they're like, I want to get all the labs and stuff. Yeah.
Yeah. Yeah. I feel like it can be so supportive because it's like, okay, great. Like maybe they're doing IVF and they get pregnant, but it's like there's still so much that we can do to help support them in that postpartum period too. And I think
Yeah.
that's a good focus on like why prep for pregnancy because it can help that postpartum stage too,
Oh,
right?
yeah.
Like if you're low in iron and then you're pregnant and then you have a baby and you're still super anemic. I mean, I've had quite a handful of postpartum mamas who come into me and they're like, I'm so tired and everybody keeps telling me it's because I'm a new mom. And then we check something really simple like their iron storage and it's bottomed out. And it's like, I'm like sad for them because I'm like, nobody checked this. And like you honestly, simple fix, like let's get you some iron and you'll start feeling better. And and so it's things like that where they can really go hand in hand.
Yeah.
Rachel, do we know anyone like that?
I was waiting for you, Katie, to speak up.
Was that you, Katie?
That happened to me when my daughter was about a year old. Like I just kept thinking, I'm just tired. Like it's harder to bounce back from this than I thought. And I eventually got my iron checked or ferritin, and it was
Yeah.
bad.
Okay.
Really
yeah.
bad.
Yeah. Oh no. I'm glad you got it checked though.
Yeah.
Yeah.
But yeah, everyone was like, well, you have a kid, like you have a baby. She's a year old and has slept through the night for the last 6-7 months. Like I should not be that tired.
Yeah.
Yeah. And this is where, like, I mean, the sleep deprivation is real. Like, obviously, that will make you tired, but this is where people are like, oh, what's common must be normal. So, like, menstrual cycles should be super painful because that's common. And, like, just because postpartum can be really rough, that's not necessarily normal. Like, they're probably, you're nutrient depleted. There's stuff you could be doing to balance your hormones. Like, that's the unnecessary suffering. Like, I hate people going through unnecessary suffering because there's some things we can't shift, but a lot of these things we can.
Yeah. Yeah.
Yeah.
And I feel like that's that like reductionistic view sometimes that conventional medicine takes where it's like, well, if, it's like, we're not going to check everything until it's like really bad. Or why would we check that if I don't have like a super strong reason to? And I know a lot of that is really like the insurance model that prohibits a lot of that workup, but we're always happy to fill in the gaps because they're usually needed.
Yeah. And I will say too, like when I build insurance, I don't know, maybe we're viewed differently and they audit us differently, but like I did not have a problem getting the labs covered for someone who'd only had one miscarriage. So I know everyone's like, oh, we have to wait till there's 3 losses. Like that's not really actually a thing. I looked into it and like, sure, to give some diagnoses maybe, but you can run the labs for the fatigue they're having and like other stuff,
Yeah. Yeah. That's
Some
what
people just don't want to do it. They don't want to deal with it. I built insurance at my practice because we wouldn't have any clients if I didn't.
Yeah.
And yeah, there are all these, like, I don't know where people get their information, but stuff like, oh, well, family counseling is never covered or couples counseling is never covered. And I'm like, yes, it is. Or these different kinds of sessions that you code differently, like you'll get audited if you do that. And I'm like, I've been billing that for 5 years and no one's ever come after me. And so I think people are, I don't know if they're lazy or they're really afraid of insurance, but I know I bill mental health, but some people
Are you saying mostly like other therapists even think that stuff isn't covered?
Yes. Yeah, it's therapists. It's not clients because they'll be like, can you come see me at my house for 2 hours? And I'm like, okay, no, that would not be covered. But I'm talking about like different session links or different diagnoses that they think won't be covered. And I'm like, no, they are.
I also think that like what I've noticed is with the general public, people think that there is this one set system that's super clear and defined and all practitioners like know it. And like half of the delivery of your care is, does your specific provider have a network and like happens to know what imaging center charges less or happens to know what imaging center does this specific type of MRI or happens to know what codes to put to get your labs covered. Like, because you can have one provider, I've had this happen to me personally, bill the exact same lab for the exact same reason, and they're just not putting the right codes to get it covered because different insurance companies like different codes and stuff. So it's like, it's all about like, what does that person happen to know? Like, I don't think patients realize that there's not this like super set defined model out there.
Yeah. And I think if you don't like the person that you're working with, like go, especially with fertility stuff, because it's emotional and it like can get expensive and there are so many tests that can be run. Like if you don't like your provider, go find a different one.
Go see April. Go drive. It's worth it. Go to drive to Minnesota or Wisconsin or Michigan.
I love that. Yes, I'm here. I'm here for whoever needs help.
Yes. Are there what's an attraction near you people can do while they visit you?
The Mall of America.
There we go. Go to the Mall of America.
That's
awesome.
a big one.
Okay, let's bring it back to fertility stuff. Okay, April, do you have any what are some of your favorite patient stories of people that came to you who couldn't get pregnant and did? What are some of your favorite ones?
I think some of my favorite stories are really people who just needed someone that was listening and somebody who was willing to do a little bit more investigation, right? And so sometimes it's like those simpler pieces where we are taking time to look a little bit deeper. And I think that's like my favorite, kind of fertility case because oftentimes the answer is right there. And just giving people that first education about their bodies, right? Like learning how to understand their cycles, time out, intercourse, which isn't fun, right? But it's like you got to know like when to be able to get pregnant because actually you're more likely to get pregnant in the days leading up to ovulation than after too. And so it's like just those little details like that, I think. So I really love kind of that education piece with patients and then kind of getting them started on a plan where they feel really supported in regard to like, okay, these are the things you can take, things like a prenatal omega-3 fish oil and then a probiotic, right? Making sure they're on like the right types of supplements to start. And then that way, like if they become pregnant, then they can just stay on that throughout the rest of their pregnancy too. So it's really that like foundational piece that I love the most.
So I've seen a lot when I was trying to get pregnant. There are all of these like, I don't know, like technology that you can use now, like the Inito I've seen that tracks all your hormones. What did like both of you, have you guys seen those? What do you think about those?
I think they can be so helpful. So I will share an example. I had a patient who started using like the Mira, which
Yeah,
is like a pretty, I think it's very similar to Anito.
I think so.
Are they the
All of
same?
them like do the,
They're very similar.
yeah, they all do the
Yeah.
same stuff.
And these ones in particular are like testing your urine metabolites. And so that can be helpful if like maybe you're somebody who has difficulties with ovulation and it's hard for us to capture ovulation on labs, right? Because if you are trying to get labs done to see if you've ovulated, you have to time it out at a certain time in your cycle.
Mhm.
And progesterone is the hormone we're looking for, and that can, it can rise and fall like throughout the day. So sometimes we might not get a really good reading of it on labs, and then we might assume that you don't have a good progesterone level, and progesterone really helps sustain that pregnancy in that second half of the cycle. Like without it, you wouldn't be able to be pregnant. And so the places I see this tech being helpful is if you're somebody who maybe has a harder time with lab testing or if you've had issues with ovulation in the past. Because if you're seeing that you're having the correct metabolites, like the correct hormone metabolites that are proving that you are ovulating, or maybe showing us that you ovulated, but you don't have enough of this hormone progesterone to keep you pregnant, that's a really important piece of information because that can definitely cause miscarriage. And it can also cause like difficulty with conception in the first place. So like those more techy ones, like the Mira and I think it's the Anito, there might be other ones that people pee on. Those ones are like definitely like great if somebody wants a ton of information, do it, but maybe you don't have to start with that. The tech that I think is easiest to start with is just trying to get your basal body temperature.
Mhm.
So that's like taking your temperature first thing in the morning. It is often taught with just an oral thermometer, but it's a different type of thermometer. It's called a BBT thermometer, and they even have them at Target for super cheap. And people can wake up in the morning, take their temperature, and then they want to log that all throughout their cycle. There's some rules when it comes to taking your temperature, like you're supposed to have slept for 4 hours before you take it, and you're supposed to do it before you get out of bed in the morning. And so that's where I think the wearables, like the temp drop, which takes your temperature and it's just this armband that you wear, or things like the Apple Watch, I know takes your temp now, or the Aura Ring, those can be a little bit more helpful if you're somebody who like feels like taking your temperature first thing in the morning is challenging. And I've been tracking my cycles for years just as like a natural way to kind of keep track of my hormones. And I will say I started with the oral thermometer and it was kind of a pain to have to like do that first thing in the morning because you're supposed to do it like even before you get up and go to the bathroom. And I can't imagine if you're somebody who maybe already has like kids or you have like responsibilities that you have to do first thing in the day. I think that's the biggest barrier. So whatever works best for people, but if they're going to start somewhere, basal body tracking, one of my favorite books is Taking Charge of Your Fertility. It's old school, but it's great. It was like written in the 80s and there's been a revised edition, but that really teaches you about like your temperatures and your cervical mucus and signs of fertility to either prevent pregnancy or to try to time out like conception so you can get pregnant easier.
If there was a great book
Yeah.
since the 80s, then where has this,
I know, right?
why hasn't this information been integrated into society?
Right? I started with I got the Natural Cycles app and like it came with the thermometer and I started with that and I would forget all the time. I'd get up out of bed, go to the bathroom and I'd be like, oh, crap, I didn't take my temperature. And so I have the Aura Ring now. It's a lot
Okay.
easier.
That's great. Yeah, I feel like whatever's easier for somebody because the good thing about technology and information, if you're trying to get pregnant, is even if you're not using it 100% correctly, it's not a big deal, because then like you still might get pregnant. I think where the technology can get tricky is if people use it to try to prevent pregnancy and they're not like 100% informed about how to correctly use it, then like that's where it gets trickier. But
Yeah.
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 Yeah. I
And
like the Aura ring. It's easy. Also, I like to get my sleep information and all the other stuff too. So I think they're like $300. It's kind of expensive, but if it's fun because you get a lot of other stuff with it.
That's cool.
I love the info. I have a temp drop and it tracks my sleep too. And I feel like that's like the main reason I'm excited to wear it, because I'm always interested in my sleep score. And if it's like bad, I'm always like, what did I do? But it is also like a great marker of health, because then you're like, how am I sleeping? Right.
Mm-hmm.
Yeah, no, that's amazing. And I'm curious, this is kind of an aside, but with the Aura ring, April, I've seen debates because it only tracks to 0.1 decimal. And like technically, I think BBT is supposed to be 2 decimal places.
0.2. Yeah.
Yeah. But because most people shift by 0.5 or more, I don't know. Do you feel like, have you seen it be enough? Because I haven't worked with a lot of people that actually have Aura rings.
I've just worked with a couple, and I've seen it be enough to give us the proper information to see if they're getting that sustained temp rise. Because what you're wanting to see is like if the temperature goes up, and then if it's going to stay up for at least 4 days, and then like obviously hopefully throughout the rest of the cycle. And so I've seen the graphs that it produces, and it at least shows that much. So
Okay. Yeah. If it
people
doesn't
who might
graph.
be like, yeah, I don't know, maybe if people are really like dialing it in, I don't know. That's interesting. I'll have to look at that.
It's probably just the
Yeah.
people who are like old school by the book. They want
That's
the
what I'm
decimal
thinking.
places. That's
Yeah.
probably what it is. Yeah.
Yeah.
Yeah, it does still, like, you can, if you ovulate, you can clearly see like the temp drop down and then goes up and stays up. So you're like, okay, like everything is probably good. You can just see like it trending the right way.
Yeah.
Okay. Okay.
The trends. Yeah.
That's cool. Yeah, I kind of want to get one, but I haven't gotten one yet.
I want to get one too. The Aura ring.
Yeah.
Yeah. Yeah. I want to get one too, because I'm like the HRV, like so many different things that it can track.
Yeah.
And
really
I
cool.
know some people don't like the Wi-Fi, but I think you can turn it off, right?
That's kind of why I haven't gotten one yet, is I'm always,
Yeah,
my body's sensitive to EMFs.
It'll still store all of your information, and then you can just put it on the charger. And then I don't know if you might have to turn the Wi-Fi back on then, or Bluetooth back on, but you put it on the charger and it'll send the information to your phone. So you just you can't see things happening in real time, like your stress. So it tracks stress throughout the day. And if you get really stressed, it'll be like, is something stressing you out? Like send a notification to your phone. So you don't have to do all of that. You can just put it on the charger at the end of the day and then get all your graphs and look at them.
Okay.
That's cool.
Yeah,
that's
puts it
good to know.
higher on my list.
Yeah.
Yeah.
Yeah. Right. And the only thing that's a bummer though is like the colors like vary in price, because like I was looking at the gold one and it's more expensive, but you know,
I have the silver one. It's
The
not
silver one's cute too. I think it's cute. I've seen it on people in stacks.
I have like tiny little fingers, and so like it just looks like this big thing. I don't have it on right now.
Yeah.
Big thing,
Like
on
a
my
high
finger.
school quarterback ring, I guess.
Yeah, it's not very cute, but since I mostly just use it for sleep, I'll like after I take a shower at night, I'll like put it on and wear it all night, and then until I get like ready in the morning, because I really care about my BBT and sleep.
Yeah.
Cool.
I saw this thing online, and I don't know if it's true, but they were creating this wearable that you can put on your earlobe to
that'd be
track
cool.
health.
Wow.
And I thought that was interesting. So I'm sure there's just going to be more and more,
Options.
options as we go.
Yeah. Soon we'll just inject an implant under our skin, like a
Honestly.
microchip for a pet. Yeah. Well, cool. Well, this has been so informative, and I feel like this would be so helpful to people who are learning more about their fertility. So thank you, April.
Thank you.
Yeah.
Yeah. Thank you for having me.
Yeah.
And thank you for the work that both of you are doing too.
Aw, yeah, we have a lot of fun on our podcast.
Yeah. I love it. It's just, I feel like there's so many people who want to know more. And I just think having sources like this are so important, because there's a lot of, like, I think the worst part about social media is there's a lot of noise and it's like sifting through it. But,
Yeah.
at least we
so
know
much
that
out
like
there.
you guys are giving the real info. So
Oh, thank you.
yeah.
Well, how can people get in touch with you or learn more about you? What's the best way to follow you?
Yeah, so I do have an Instagram. So it's Dr. April Jones, ND, N as a naturopathic, D as in doctor. Otherwise, my website, www.apriljonesnd.com, are both good ways. And if people are in the Minnesota or Wisconsin or Michigan area, I do offer alignment calls. So that would be like a 15-minute call where they could kind of learn more about working together before we book the first visit. And I think that can be helpful for people who might just have more questions about working together or, want to learn more about naturopathic medicine.
Awesome. Well, we'll
Yeah.
put all of that in the show notes below. So it'll all be linked. So if anyone wants to reach out to you, then the link will be in the show notes.
Perfect. That's great. Thank you. Thank you both for having me.
Yes, thanks for being here. Well, thank you for listening, everyone. Appreciate it.
Yeah. We'll catch you in the next one.
Thanks for joining us for another weekly reset. If you loved hanging out with us today, subscribe so you never miss an episode, and share this with a friend who could use a little calm and connection too.
This show is for education and inspiration, not medical advice. To learn more or connect with us, check out the show notes below. Until next time, take care of your mind, your body, and your heart.